In this video, we'll be talking about erythropoietin, often shortened as EPO. This hormone plays a vital role in ensuring that our blood has enough red blood cells to transport oxygen. So, in this video, we are going to go step by step. First of all, we are going to see what erythropoietin is, and then where it is produced, how it works, and the regulation of its release, and then finally the clinical importance. So the first one, what is erythropoietin? Erythropoietin is a glycoprotein hormone that stimulates the production of red blood cells, which are called erythrocytes. And this happens in the bone marrow. So the word itself comes from erythro, which means red, and then poiesis, which means formation or production. So erythropoiesis literally means red blood cell production, and erythropoietin is the hormone that drives this red blood cell production. Now let's move over to the site of production. So where is erythropoietin made? The main site of erythropoietin production is in the kidney, specifically in the specialized cells of the peritubular capillaries in the renal cortex. So about 90% of erythropoietin comes from the kidneys, while the remaining 10% is produced by the liver, especially during fetal development. So this point right here is very important and might come out in your examination. So it's simply 90% of erythropoietin comes from the kidney, and then the remaining 10% is produced by the liver, and this happens especially during fetal development. So when the kidney sense that oxygen levels are low in the blood, their response is to release more erythropoietin. Now let's talk about the stimulus for erythropoietin release. So we can say erythropoietin secretion is tightly linked to oxygen availability. The main stimulus is hypoxia, which means a decrease in oxygen supply to tissues. Now, common situations that trigger erythropoietin production include high altitude, which is where oxygen levels in the air are lower. Another one is blood loss or anemia, which is less hemoglobin available to carry oxygen. Then the third one, chronic lung disease, which can lead to impaired oxygen intake. And then there is the cardiovascular problems, which reduces oxygen delivery to tissues. So whenever the tissue sense a low, so in summary, whenever tissues sense low oxygen, the kidney's response is to produce more erythropoietin. And that takes us to the mechanism of action. So let's take this step by step on how erythropoietin actually works. So the first step is hypoxia is detected. That is what we have just talked about before. So the oxygen sensors in the kidney detect low oxygen tension. Then step 2 is erythropoietin secretion. So peritubular fibroblasts in the kidney release erythropoietin into the bloodstream. And then for the third step, the erythropoietin travels to the bone marrow. The hormone reaches the red bone marrow, which is the site for red blood cell production. And then step 4 is stimulation of the progenitor cells. So the erythropoietin binds with or to receptors on the erythroid paragenitor cells, which are the early precursors of red blood cells. And then this prevents them from undergoing programmed cell death, which is apoptosis. Instead, they proliferate and mature into red blood cells. Now for step 5 is increased red blood cell count. So as more red blood cells are produced, hemoglobin levels are obviously going to rise, and then more hemoglobin means that oxygen can be transported to tissue. Now that takes us to step 6, which is negative feedback. So once oxygen levels return to normal, we can simply say the erythropoietin production decreases. So with this, we can say that erythropoietin is a perfect example of negative feedback mechanism in maintaining homeostasis, and this is simply to maintain oxygen balance in the body. Now let's go to the regulation of erythropoietin. The regulation of erythropoietin is primarily controlled by the protein called the hypoxia inducible factor (HIF). So under normal conditions, HIF is degraded quickly, but under low oxygen, HIF becomes stable and activates the gene that leads to increased erythropoietin production. So this ensures that erythropoietin is produced only when it is needed. Now let's go into the functions of erythropoietin. Now in summary, their major functions include 1. Stimulates red blood cell production, which is its primary role. Number 2, it enhances hemoglobin synthesis, which is more oxygen carrying capacity. And then number 3, it prevents apostosis of immature erythroid cell in the bone marrow. And then number 4, it supports tissue oxygenation. It ensures that every cell in the body receives enough oxygen to function. So without erythropoietin, red blood cell production could drop drastically and the tissues would suffer for oxygen deprivation. So as you can see, this hormone is very, very important. Now let's go into the clinical importance of erythropoietin. The first one is erythropoietin deficiency. So patients with chronic kidney disease often have anemia because their kidneys cannot produce enough erythropoietin, and this condition is called renal anemia. The number 2 is therapeutic use. Synthetic erythropoietin called the erythropoietin alpha or similar drugs are used to treat anemia, especially in chronic kidney disease patients, cancer patients undergoing chemotherapy, or premature infants with underdeveloped kidneys. The number 3 is sports and doping. Now you may have heard of the erythropoietin in context of athletes. Some athletes misuse the synthetic EPO to boost their red blood cell count, and in doing so they improve oxygen delivery to their muscles. Now this is simply to enhance endurance, but it is considered illegal doping and carries a health risk such as blood clots or even can lead to strokes. Now number 4 is excess erythropoietin. So during certain tumors, now sometimes certain tumors can produce excess erythropoietin leading to polycythemia, which is an abnormal red blood cell count. So this makes the blood thicker and increases the risk of clotting. So in summary, let's wrap it up. Erythropoietin, also called EPO, is a glycoprotein hormone that stimulates red blood cell production in the bone marrow. It is mainly produced in the kidneys, with a small contribution from the liver, which is just 10%, and 90% from the kidneys. Now the main trigger for its release is simply hypoxia, which is low oxygen levels in the body, and then it works by stimulating the progenitor cell in the bone marrow, preventing their death and then promoting their maturation into red blood cells. Now, erythropoietin has a major clinical importance in treating anemia, especially in chronic heart disease, but it's also associated with misuse in sports. So, the next time you think of how your body adapts to low oxygen, remember that erythropoietin is the hormone that makes it possible. So there you have it, a summary of erythropoietin and how red blood cells are produced in the bone marrow. Thanks for watching. Until next time, bye.